Imagine leaving the doctor's office with a prescription containing just one single pill. One single pill that you take once, and it will instantly improve your cognitive abilities, your memory, and your thinking skills. This marvel of modern medicine will also improve your strength, improve your balance, reduce inflammation, and reduce insulin resistance. It would also significantly reduce your risk of developing chronic conditions like dementia, heart disease, cancer, depression, anxiety, recurring strokes, and type 2 diabetes. Not only that, it would also increase your heart's working capacity, improving blood flow and the delivery of oxygen and nutrients to your brain and throughout your body. Of course, this would also help to improve your mood, as you'd feel younger, more capable, energetic, sleeping better, waking up better, strong, happy, and sensational. Now imagine this pill. Having access to it would make it almost illegal for doctors not to prescribe it to all of their patients, no matter their age or medical record. Now the problem is that there is no such pill. The prescription that I'm talking about is exercise. In fact, there are countless articles and studies showing the importance of physical activity for health and well-being that are being published every week, month, and year on end. Now, obviously, it's impossible to fit exercise into a pill. Well, at least for now. But still, the importance of physical activity does still not seem to have found its rightful place in modern medicine, as medical professionals don't incorporate it nearly as much as they should into the treatment plans, prevention plans for their patients. Now, is there a problem here? Somehow it seems like this kind of preventative strategy is beyond the scope of what's included in today's modern medicine. Today, modern medicine is amazing at treating illnesses, diseases, chronic conditions through diagnostics, lab work, x-rays, pharmaceutical and treatment plans. In fact, developing a chronic condition is no longer a death sentence, but rather just a lifelong membership to increasing number of prescriptions and back and forth trips to the hospital or the local outpatient clinic. But somehow it seems like the better we become at treating such conditions, the less we or our healthcare system care about us developing them in the first place. Today, more than 40% of the world's population suffers from a chronic condition. And roughly 25% suffers from 2 or more. Now, how is it possible that the prevalence of chronic disease is on the rise when our healthcare system and modern medicine are making such big strides with new technologies and diagnostics tools being innovated by the minute? Do we really have the right focus here? Or is our traditional way of seeing, understanding, and accepting healthcare really the most optimal for us? For you, for me, for the everyday person? I believe not. Now imagine the fire department. Think about how they work. They spend the majority of the time, energy, and efforts on preventing fires. And I'm not just talking the use of smoke alarms. I'm talking about informing, advising, educating, supervising, inspecting, and governing everyone from the single individual to communities, private companies, and government authorities. All in order to make sure that if there's even a small or minor risk for a fire breaking out, they're able to find it, take care of it, before this possibility of a fire breaking out turns into reality. Only a small segment of their day-to-day work and efforts has to be spent on actually putting out fires, because they do such an amazing job at preventing them. Now let's pause and imagine if we had the same focus in our healthcare system. Imagine if doctors and nurses spent the majority of their time, energy, and efforts on preventing their patients from becoming sick. A shift from treatment to prevention. And when I'm talking about prevention, I want you to think that I'm not just talking about primary prevention, where a completely healthy person is preventing the onset of a chronic condition. And it's Very important, so let it be clear that I'm also referring to secondary and tertiary prevention. When a person already diagnosed with one or more chronic conditions is preventing the onset of another one, an additional one. Maximize your health. Focus on prevention, no matter the starting point. So would this shift in focus also change the way that we then perceive modern medicine and healthcare? Let's find out. If I asked you to think about the word healthcare, what do you think about? Was it perhaps a boring, gray, concrete building, also perhaps known as a hospital? A hospital you rarely want to step foot in or visit? And was it related to sickness, pain, and trauma? Now, why isn't the word healthcare associated with something enthusiastic, motivating, and positive? I mean, shouldn't it be? Why can't healthcare be associated with taking care of one's health, being the best version of yourself, preventing the onset of a chronic condition while staying healthy, happy, harmonious? Health, care. Now, all over Europe, the Americas, and Southeast Asia, the modern medical tradition has long been governed by paternalism. And despite some of our best efforts, it's never been able to break away from it. Today, we mostly understand the human body as made up of many different small parts. And we believe that if we can somehow take and make each individual part work well, then somehow the whole person will work well. And this is accomplished through diagnostics, lab work, x-rays, pharmaceutical, and treatment plans. And then modern medicine think that they've done their part, leaving it up to the single individual, the patient, to implement all of it. And when they fail to adhere to the instructions and the recommendations from their doctors and nurses, they're being called non-compliant. Non-compliant to their medical plan and non-compliant to their treatment plan. They're simply just being non-compliant. As if it's their fault for not being able to take this rigid plan and fit it into their daily lives, when it was never really designed for them in the first place. And no treatment plan has ever worked if the patient isn't motivated or compliant with it. Well, let's imagine again that we turn this system completely upside down or inside out, whichever way you want to think about it. And starting off, let's not think of people as just patients. Why? Well, because no one sees themselves as just a patient. Outside of the hospital or anywhere else, they're a person with their own goals, aspirations, social life, struggles, and limitations. So let's move away from just calling them patients and start thinking of them as people. And as people, they should not just play a passive part or simply be assigned a rigid medical treatment plan, but instead they should be the driving force. They should own their own health journey. Why? Well, because they are the ones solely in control of which pills they want to take, which diets they want to follow, how much they exercise, whether they use alcohol, tobacco, or drugs, what their sleep habits are like, and how they handle stress and frustration. In fact, they are, just like all of us are, in strict control of the variables that drive 90% of the determinants of how well we live with chronic conditions. Whether we get them in the first place, and how well we live with them. So shouldn't modern medicine focus on helping people improve those 90%? That's prevention. The reactive, high acuity stuff like operations and traumas are very important as well. But the focus should not only be on having the best reactive care, but also on the best proactive and preventative care. The least risky operation is the one that never needs to take place. Now, with an increased focus on prevention, healthcare professionals need to be able to offer people the right tools, information, and motivation to best become the driving force of their health journey, customized for each person. Here, you can't get away with trying to meet a person's specific medical and health needs with the current rigid healthcare structure and plans that you already have in place. A professional-centric model. What's easiest for the doctors and the nurses? but rather need to reorganize and redesign the healthcare business model to be evolved and designed for the specific needs of the people who should use modern medicine only as a complement to their health journey. In this more advanced healthcare role then, the main skill sets of medical professionals should not only be that of lab work, x-raying, prescribing the right pills, diagnostics, or creating treatment plans. It should also include that of a health coach. A health coach that influences, that partners, educates, and cheers you on. A coach that helps people make the right decisions by providing them with the right tools, information, and motivation to do so. Now, unfortunately, being able to influence someone or being a people's person isn't what's going to get someone into medical school. And it doesn't help any aspiring doctor to pass that physiology or biology exam. But somewhere in that decade-long education that medical professionals go through, should there be an emphasis on inspiring, influencing, coaching, the very same people that they will spend the rest of their professional careers helping. A big part of medical school is the field of anamnesis, how to collect the right information by asking the right questions, and that's great. But where are the courses on motivation? Where are the courses on how to actually influence someone to make better health decisions? So of course, this is not something that's just going to change overnight. But what is one thing that modern medicine can do today to start influencing and inspiring people to become more active in their medical plans? One thing. Well, if we go back to that amazing small pill with numerous health benefits, well, you know, the one that doesn't exist. Well, the pill doesn't exist, but the amazing health benefits, they do. And they don't need to be packaged into a pill to be prescribed to people. Now, physical activity is amazing. Medical exercise, even more so. And when I'm talking about medical exercise, I'm talking about physical activity that is planned, structured, and continuous for the purpose of conditioning the body, lowering the risk of becoming chronically ill, enhancing both physical and mental well-being, ultimately increasing quality of life. It's simply a magic cure, an amazing recipe for a healthier life. Now let me ask you this. When was the last time your doctor told you that for every hour you exercise, you live between 2 to 5 hours longer? For every hour that you exercise, you live between 2 to 5 hours longer. It's true. Just following them, the international recommendations of at least 150 minutes of moderate intensity exercise a week, you could live more than 10 hours longer. Now imagine doing this week in, week out, month after month, and year after year. The only thing you're going to have to worry about is asking yourself, what are you going to do with all this extra time in your life? If we focus on prevention, medical exercise should be incorporated into every health and treatment plan for every person, no matter the person's starting point, age, medical history. Modern medicine could start focusing on this very simple idea that has the potential to create amazing, long-lasting health results. This simple idea could be the catalyst for this new way of structuring and thinking of healthcare, with a strong focus on prevention. So even if you're not being pushed by a doctor, and even if you're not being influenced or coached into living a healthier lifestyle, remember, you are in charge of 90% of your health determinants. You are in charge of your own health journey. So even if it isn't prescribed to you, create your own magic pill. You take it, you get up, you get moving, you get active. Every day, every week, and every month. This way, you prevent disease instead of putting out fires. And so let me leave you with this. Become the driving force, become the pilot, and become the master of your own health journey. So that the next time that you hear healthcare, don't just think of a boring gray old building. Think about taking care of your own health. And I promise you, your health will take care of you. Thank you for listening.